services for anything you might want. So it's a great way to get some information. All right, so our community panel is ready to go. And again, we have someone from our community joining us, very concerned about the community, who's going to moderate for us, Shelly Ribando from Channel 7. Shelly, it's yours.
Do they do it back there, or do I do it? Oh, there we go. Guess I'm not as loud as they tell me. If you watch our newscasts on any regular basis, you see how many stories we do on fentanyl and how it has so sadly affected so many people in our community. We had, even just last night, many stories in our 10 o'clock newscast, and listening to parents and just seeing the devastation it causes so many families. So I'm really glad to be here today, and I hope you enjoy this program. Looking through our panel of experts, it's an amazing group of people, so I'm honored to be here, and thank you. I'm going to go through and introduce everyone who's here, and if you just want to give a slight raise of your hand so everyone can see who you are. We're going to start with Dr. Snehal Bhatt. He's the Chief and Fellowship Director, Addiction Psychiatry Associate Professor, Psychiatry and Behavioral Sciences at UNM. Thanks for being here. We also have Margarita Chavez-Sanchez, the Director of the Bernalillo County Behavioral Health Department. Gilbert Ramirez, Deputy Director, City of Albuquerque, Family and Community Services. Dr. Daniel Duhigg, Medical Director, Duke City Recovery Toolbox. Dr. Laura Rifka Stern, Medical Director of COVID Response at the Westside Emergency Housing. Dr. Anjali Taneja, who is the Executive Director of Casa de Salud. Jennifer Weiss Burke, Executive Director, Serenity Mesa Youth Recovery Center. Cory Lee, Executive Director of Crossroads for Women. Erica Abeyta, Statewide Overdose Prevention Supervisor for the New Mexico Department of Health. Jessica Brooks, the Albuquerque Public Schools Crossroads Counselor. And Steve Decker, Chief Executive Officer for Heading Home. All right, let's start first. What we're going to do is I have some questions here, and I'm going to direct them to particular people on the panel. And if we get through a lot of the questions, we're going to open it up also to any of you out there who have any particular things you'd like to ask a member of the panel as well. Let's start first with Dr. Bhatt, Dr. Stern, and we're going to start with how you exactly would describe fentanyl to clients who ask, why is this a different drug? Exactly what is this? And how can parents talk to their kids about fentanyl in particular?
Great. I can start it off here, okay. Snehal Bhatt here. So I think the first thing that I start out by saying is that while I may know a lot about it from a medical standpoint, the patient really knows, they're the experts, right, in their own lives. So I think even with the discussion about fentanyl, I like starting out just by asking them, tell me about how this has impacted your life. Mm-hmm. You know, what kind of relationship is there between you and this substance, right? Well, you know, just understanding more, right? Because oftentimes, right, and I think all of you guys in the audience can relate to this, that our patients just have so much more, right, than that, just that addiction, right? When I think about my patients, many of them have like trauma. They've been resilient. They've overcome that. So I think it's important to acknowledge that. And then with their permission, as I go into fentanyl, some of the big points I try to hit, one is that if you don't know what you're using, assume that it's fentanyl at this point in 2022. Because that's what's out there, as people have said, right? Whether, even if it looks like a blue oxycodone tablet, chances are it's fentanyl. And the other point I hit is that while fentanyl is an opioid, just like oxycodone, just like heroin, it is a far more potent, it's a lot stronger, and B, it's unpredictable, that it's not manufactured by a drug company. We don't know exactly what's in it, right? So keep that unpredictability in mind. And then really moving towards harm reduction as the third thing. So maybe kind of not using alone, having Narcan with you or people you're with, right, as a harm reduction strategy. And last but not least, I really try to hit the point that treatments work, our medications work. How can we engage you in treatment? What might be the barriers? What might be your fears that maybe we can address? And really taking that approach, I think, is the best way to go.
Okay.
Thanks.
And Dr. Stern, how about you? How are you helping the folks who probably are scared to even ask for the help? What advice are you giving them, especially maybe parents who are coming in and are confused about what they're hearing and they're concerned about their own children?
Sure. I think the most important thing is to just keep dialoguing with your children and, you know, trying to find out. So many people get started on fentanyl because a friend gives them a pill and says, here, this will help you feel better. Whether it's a lot, I've seen it with adults with chronic pain, and somebody hands them this pill, and then they're like, wow, that feels good, can I get another? And so they were already struggling, and I think with children, it's the same thing. I mean, when I had teenagers in the house, and you find pills in their backpack. It's really scary. And now with fentanyl, it's scarier. I don't know if anybody had brought up about rainbow fentanyl, but there are bags and bags out there of multicolored pills that, look almost like Skittles, right? That I think are targeted for children. So, ask, have your kids, has anybody given you a pill? What have they told you about them? Try to engage and see what people are doing.
Okay. And Jessica Brooks, you're with APS, so meeting and talking to students every day, any advice that you're giving them, or even teachers, some signs to look for in the classroom?
Yes, thank you for this question. I am a Crossroads counselor, and there are 13 of us within the district of APS, and our sole job at APS is to provide education, prevention, and intervention around substance use. And the 13 of us reside at the high schools, but we also work with our middle schools and our elementary schools too. So we have daily conversations, not only with our students around substance use, but also with our parents. And many of our guardians and our families and our caregivers that we talk to and work with daily, they're receiving a call from the school that their student might have been caught with drugs, paraphernalia, or maybe are under the influence. So many of the parents, guardians, and caregivers that we work with are scared. This is the first time that they've heard that their student might be using or involved in this activity. So we're opening up the conversation, helping them understand the risk that their student might be facing, helping them connect with services. We work with the UNM Star Clinic, Serenity, Mesa, and many of the other partners that are here today too. So we help them have that conversation, because this might be the first time that they've talked to their student or child about it, but we're always encouraging lots of conversation, early conversation, talking about some of those warning signs that they might see with their student. We also do prevention, education, intervention with our staff, all of our faculties at all of our schools, so they know what to look for as far as signs and symptoms of use.
Can you name a couple things really quickly if there's any parents out there looking for like the key signs maybe they should be looking for?
Sure. I mean, we look for change in habit and behavior. So a student that might be engaged in school has all of a sudden taken a drastic turn and isn't engaged, doesn't want to get out of bed, doesn't want to attend school. Maybe some of their passions and their hobbies, they've let those fall away too. So they're changing in behavior, changing in hygiene habits. So somebody who would get up in the morning and shower and get dressed, that child might not be interested in doing that at all or whatsoever. Change in friend group. So all of a sudden, the child might be hanging out with kids that you don't know, doing activities that are something that you're not familiar with your student doing. And when we work with parents, we instruct them to look for a variety of change in this behavior. It's usually not one thing. It's not that drop in the grades. It's usually a couple things that are going on. So we're looking at the whole picture, taking a look at the students, making sure that some of those habits that you know that your child is doing, if it's changed, that's worth looking into. That's worth having a conversation.
All right, very helpful, thank you. Next question, what are some of the dangers of actually combining the fentanyl with other substances, such as alcohol, maybe benzos even, or methamphetamine? Dr. Duhigg, we're going to start with you.
Thank you. The more intoxicants anybody uses, the bigger the risks, right? Especially if the other things that they're using also decrease the drive to breathe. I mean, that's usually what lands people in the office of the medical investigator and leads to the death. So combining benzos, things like Xanax or Klonopin or Valium, with any opioid, really, but especially fentanyl, they work together. We say that there's a synergy It's twice as much effect on not breathing. But other things happen too. So a lot of people are finding now that methamphetamine, for example, and fentanyl are being mixed. And they might have thought they were just getting one or the other, but then they find both, or we find both in their pee and have a conversation about it. And now that's not increasing the likelihood that they die from not breathing that mixture. But now, especially if they continue to use both together, now they essentially have two addictions that are working together. They're withdrawing from fentanyl, opioid withdrawal, and withdrawing from methamphetamine, the meth withdrawal. And it's not like, well, if you just have an addiction, you have kind of one addiction and it doesn't matter what flavor it is. Really, all the different addictions are different illnesses or different diagnoses. We treat some of them. Some of our treatment for the different ones are similar, but there are also some differences as well. And I find in my clinical experience, people who are using both struggle a lot more to get off of either one than people who are just using one. And alcohol goes into that same mix. Alcohol, like benzos, decrease our brain's desire to breathe. And so mixing alcohol with blues or with fentanyl can be very dangerous. Even, mixing amounts of alcohol that weren't previously dangerous or weren't previously problematic for a person. We now add the opiate to that, and it's a totally different story.
And Dr. Stern, similar question. Are you seeing this happen often when you're relating to patients? And
Yes.
yeah.
And again, we see it that people don't know that things are being mixed, or they think they're on oxy, and we do a drug screen, it's negative, and we go in and tell them they're on, taking fentanyl, and they didn't know. We see a lot of people now with meth and opiate addiction, and the mixing is confusing to them because, they might be used to the withdrawals from methamphetamines, and then they're having other symptoms and they don't understand what those are.
Okay. I've heard from viewers, from parents who will contact us, they feel that this is so easily accessible now. Jennifer Burke, can you speak to that? How are people mostly getting it? How do they know the contacts, or are they just looking this up on social media? Where do they begin?
Well, I think we've heard a lot of talk this morning just about the different ways that people are acquiring drugs these days. And it's not like it used to be where you had to go to a bad area of town or you had to, find somebody hanging out on a street corner. Now, you can get it through social media, like the DEA was talking about this morning with Snapchat, and then the new app that was mentioned this morning that I've never even heard of. So, there's a lot of conveniences out there that didn't exist before. And so for our young people who are very IT savvy and very used to using that type of technology, it's nothing for them. Now, us as adults, we don't know half of the ways they're getting it. And we don't know what they're calling it because those, the emojis that they're using. I run a treatment center called Serenity Mesa, and we had our clients here this morning. They were sitting in the back, and so they saw Carlos's presentation from the DEA, and the first thing they said to me was, how does he know all that stuff? So kudos to you, Carlos. But they were like, oh, and by the way, those emojis are no longer being used. So you're right. There's new emojis out there, but they know. And I told him, I said, well, we're like 10 steps behind you. Like, we're trying to keep up, but you guys are the ones that we need to kind of learn from. And because it's so easy right now, we have an apartment program, so we put some of our clients who graduate our program into apartments, and we provide rental assistance. And we were visiting one of our clients a couple weeks ago, and there was a homeless encampment that was set up across the street, and there was young people riding bicycles with backpacks that were just going to these homeless encampments and selling them drugs right there in broad daylight. They weren't trying to hide it. They weren't ashamed by it or anything. They were just riding through. So that's, they're delivering them right to wherever they're at.
All right, thank you. And Margarita, Chavez-Sanchez, where do you think a lot of the kids in particular are getting it from? I know I've had other parents tell me they kids know the locker to go to between classes. It's frightening to hear that, right? That there's not some more control and how this is not being noticed. But what are you finding?
I think I really echo what Jennifer said and what's been said in earlier panels today, is that we tend to be about 10 steps behind, right? So by the time we found out about that locker, the locker's been cleared out and it's now at a different locker or in a different gym bag. And I think really in young people, it's difficult to navigate because I do Snapchat, but I can do a snap, and that's about it. I can't do all the other fancy stuff. And I think I'm technically savvy, but my daughter can do a whole lot more on that. And I think it's really important to just recognize the value of having conversations, right? The value of having conversations with your children, with young people in the community. I think somebody said earlier in one of the panels, understanding when something's off, right? Having relationships so that you can understand when something's off. So now you have a space to ask those questions. Now, in the work that we do at the County Behavioral Health Department at the CARES campus, we are seeing access in a different way than maybe we have ever seen with previous substances. Our clients have to navigate ways to access heroin or access methamphetamine, but fentanyl, they can get immediately and they can get it much cheaper. And as we've heard, the potency is at a much higher level. And so for folks who have been navigating addiction and maybe they've been using heroin for many, many years, maybe they started using fentanyl unbeknownst to them, but now their tolerance has changed. And now their request for a substance has also changed because again, the way that their body is reacting to the new substance is completely changing the morphology of their whole body, right? It's really changing the way that they operate on a daily basis. And it's so much easier to access fentanyl than it has been for other substances in the past that I think that's why we're seeing such negative impacts in the community.
So many times people hear about Narcan being, the magic that, can you have it on hand at home and how do you get a hold of it? Will it always work? How does it work? How is it administered? Should every parent who has a child have it in their medicine cabinet? How do we get it? Erica, Abeyta, let's start with you.
Absolutely. Naloxone works by blocking the effects of opiates on the brain. It only works if there are opiates in the system and not with other drugs, just to make that clearly known. It's easily accessible in the communities, and we work hard to educate our community members on how to recognize and respond to an overdose and increase the access to and use of naloxone in our communities, because we think it's really important. Sometimes there's a lot of misconceptions that people who need naloxone are only individuals who have substance use disorders, or communities that are large only deal with overdoses. And that's a huge misconception because substance misuse impacts many individuals. It impacts large communities, rural. It affects tribal communities, large and small. There's no socioeconomic class that people, only those type of people will potentially suffer an overdose. It doesn't discriminate against age or gender. I recommend every household have Narcan on hand, naloxone, because it's so important. You never know. Sometimes the thought is, well, only individuals, again, that are battling substance use disorder are the ones that need it. But no, it could be a grandparent. It could be someone who has been prescribed a prescription painkiller that needs to have that naloxone. Plus, you never know when you're going to encounter someone that is experiencing an overdose. And it's really important to have it. And it's so easy to administer it. I'd like to take this moment real quick. I have a visual here. A lot of folks, when they get it, and by the way, this is largely available in communities across the state. As a Department of Health, we worked aggressively to train out community members who then become Narcan hubs in the community. Our harm reduction program does the same. So it's easily accessible and in many cases free. And so when you have naloxone, you open it up, and a lot of individuals just simply get it out or try to pull it out like this. Just a quick note, tip. Because I'm all about the tips, opening it up and dropping it in your hand, because this little plunger is so easy to just click. And so it's easy, just place it in the nostril and press it. The really cool thing about this is, again, it works to block the effects of opiates in the brain. We highly recommend that you wait 2 to 3 minutes before administering an additional dose. And because of fentanyl and its potency, we acknowledge that it might require more than one dose of naloxone, and again, waiting 2 to 3 minutes. But this has largely become available across the state.
Thank you. Dr. Bhatt, if someone Dr. Stern.
Oh, and then,
Did you want to go first?
Sure, go ahead.
I just wanted to add, Albuquerque Public Schools has put Narcan in all of our high schools, so we do have that available for our, in the health office. Also, the Crossroad counselors do train staff members, administrating teams, and I'm at Atrisco Heritage Academy High School, where we have 2,200 students in the South Valley. And this year I've opened up Narcan training for our students, because they know that they can save a life when they get home, when they go to a party. If they have exposure to fentanyl, they'll be prepared. So Albuquerque Public Schools is also fully prepared.
And to add to that, there is no harm for folks who use it, even toddlers, high schoolers. You can use it on anyone, and so it's really clear to make that understood, because some people might think, well, it may not work with my body or it might harm me. No, it's going to help, if anything.
Yeah,
And
great to
so
know, because that was
make
actually a
sure
question I had. Dr. Stern.
I just wanted to say that recently a friend of mine was prescribed some narcotics after surgery and was given a prescription for Narcan, but it cost $100. It was not covered by his insurance, and so he didn't get it because it cost too much. And so I really want to put out there, you know, the importance of having Narcan available for free or for a very reasonable price.
Okay, yes.
And if I'll add, let me just get a show of hands. Who has Narcan in their home? That's great. Who does not? Okay, anyone who has your hand up, you can go into the resource room, go to the back wall where that wellness table is, and we have 200 kits available for anyone who wants to take it home. You can get the training immediately at the Department of Behavioral Health table, and you can go home with a free Narcan kit. So that can happen today, right now. Now, if you know someone else who needs Narcan, or if you use it and need another kit, the Department of Behavioral Health Services at the CARE campus at 5901 Zuni is a community distribution site. So anyone who gets a prescription who doesn't want to pay, right? Nobody wants to pay $100 when you can get it for free, right? Or if you know someone who is using, or if you need something to have in your home. My grandmother, who was undergoing cancer treatment, she was on opiates during her treatment. She took a pill, went to sleep, forgot she took it, woke up, took another pill, and she overdosed at home. And so very, very fortunate that my aunt was able to see what was going on quickly and call EMS, and they were able to come in on site and use Narcan on her and save her life. But if we had had that Narcan in our home, there would have been much less of an impact, because that could have been available immediately. And so, again, I provide that little bit of a personal story, because that's not the picture that we think of when we use Narcan, right? And so if you have any type of medication access in your home that is opiate related, there should be a kit there. If you work in the community, you should have a kit in your vehicle. If you work out with a population who's needing this support, Narcan is available to you. So another plug, right into that resource room in the back by that wellness space. We have Narcan kits available today, or you can come to the CARE campus for those at any time.
And that distribution site, real quickly, on Zuni, that's free and open to the public at any time?
It's free
to
to open
give that
to
away
the
on
public.
the news?
Yes,
Okay.
24/7, 365. We have staff on all shifts trained as trainers,
Great.
and they will do a 3 to 5 minute quick training on Narcan, and you can take a kit home immediately.
Amazing information. We'll
And
make
to
sure to
that-
put that on the news, yeah.
Just kind of jump in. So I think really want to highlight a couple of points, right? One is we want naloxone out in the community. One of the things that I tell, right, sometimes I'll talk to a community member or patient and they're reluctant, but I don't need it. And my response is, it's like having a fire extinguisher. Hopefully you'll never need it, but if you ever do, you'll be really glad you have it. I've carried it in my car with me for the last at least a couple of years, and I've had the opportunity to use it on 2 different occasions, right? Just being in the community. A few years ago, we did this study at our clinic, right? So I work at the UNM's Substance Use Disorders Treatment Clinic, where we started training all of our patients on naloxone and giving them kits, right? As many as you need, use them, and we track them. And we followed them, and over several months, they reported, over 100 overdose reversals. But here's the neat thing, that in all except one case, it was our patients using naloxone on someone else and saving their lives. Our patients were in treatment. They weren't overdosing, but they had it, they knew how to use it, and they still had social networks, people they knew who were at risk. And right, and so it's a life-saving opportunity and also a way to empower our patients that you can be in this position to help someone. So we want to get this out. That's number one. Second, New Mexico has a couple of really good laws. One is a Good Samaritan law. So if you do use this on someone, you are protected legally. And we also have a standing order at the pharmacy. So you can go in there and pick up naloxone. The last thing I really want to highlight is the importance of calling 911. So say I overdose right now, and I, fall to this table, slump down on the ground, and Margarita, thankfully, is sitting next to me. And she uses this, right? I've got the kit here, and she administers it again. One thing that's really important is to still call 911. So the first responders can get here and give me definitive treatment, A. I may also have other things on board. Maybe I took a Xanibar 15 minutes ago that the naloxone is not going to do anything for. So they can help with that. And third, if I get connected with the first responders, they take me to an ER, I get connected with providers, that's my opportunity to get into definitive treatment. Naloxone's great, it just saved my life, but the next thing is that we want to make sure that I get into treatment. I get on one of those life-saving FDA-approved medications like buprenorphine, like naltrexone, like methadone, right? So by calling 911, you're also potentially creating that chance to get me into treatment, to change my trajectory long-term.
And let's talk more about treatment. Dr. Taneja, can you speak to how does one access the treatment? How long does someone have to, if they say, okay, I'm going to go in, I need the help? Is this a long commitment? Can this be done quickly? What can people expect if they're seeking the treatment?
Yes, I don't know if my mic is on.
Yeah, now it's on.
Okay, Anjali, Taneja. I think treatment with medications like buprenorphine, which is known on the street as Suboxone, methadone, these medications are incredibly helpful. Right now in the United States, 90% of people who could potentially benefit from medication-assisted treatment don't have access to it. There aren't enough resources in communities. There aren't easy ways to find out how to get treatment. There's a lot of stigma among families and communities that treatment is a crutch and not actually being off heroin, fentanyl, whatever other opioids. And that's something that we need to shift. We also need to shift how easy it is for people to get into treatment. We have heard all morning about emojis and social media and how cheap fentanyl is, and we are dealing with a problem that is only getting worse. Here in New Mexico, we had a zero wave before the pharmaceutical industry and doctors prescribing a lot of opioids. We had intergenerational heroin use, opioid use, way long ago. And then the next zone, or the next kind of phase, was pharmaceutical companies producing opioids, talking about how safe they were, how great they were for pain, doctors prescribing them a lot. And then we cracked down on that without enough opportunities to meet the moment on that. And so a lot of folks who were using opioid pain pills now moved to heroin, didn't know how much to use, didn't have easy understanding of it. And then we cracked down on that, and we, as a result of not meeting the moment with treatment and support and other things, have created, in some ways, this wave of fentanyl, and now a wave of fentanyl being mixed with a number of other medications, which are, or drugs, which are deadly. So our kind of like enforcement type attitude of a lot of where we're going with things is not working. It's only getting worse. And drugs are more cheaply available. We can talk about the cartels all we want, but we're not doing the work as we can as a unified community of providers, community of governmental agencies, to best meet the moment with treatment, love, support. A big reason why a lot of people use opioids is because they're in emotional pain. And what can we do to support them so they're not trying to escape that? A big reason why a lot of people use opioids is because it's just given to them. A big reason is they had a physical injury and now are stuck and they don't have a way to get out. We have to meet the moment, and during COVID, things have gotten astronomically worse. In the US in 2021, we hit the highest number of overdose death rates, 100,000, and 60 to 70% of those have fentanyl in them. I am grateful for the county and city and other folks putting this on, and this is a great awareness campaign, but we need to use this moment and this opportunity to make treatment as readily available by emojis, by texts, by we will go pick you up and bring you where you need to go, by love, by actually providing real treatment in jails and prisons. The State Department of Corrections has 0 medication treatment for people. We heard that in MDC jail, more than 1 in 5 people is coming in on fentanyl. We are not meeting that moment. We do have treatment options in the jail, but they are not meeting the need. We are not screening everyone, offering it. We need to find ways for treatment to be as readily available and as exciting, and also people showing each other that treatment works. I've worked with thousands of patients by this point in my career, with, maybe that's a little hyperbolic, hundreds of patients and many community members, and we ask them, what do you think would work? We have folks at Casa de Salud at our clinic saying, we need treatment in prison. We had folks there for so many years. Suboxone's $1,000 a film, and they're talking about how readily available it is. Well, let's bring treatment in, and then you won't have this black market there. We have patients stating, we need ways for someone to be able to text a number and get to a place immediately. We have in our current ecosystem no real way for someone to easily find help. There's a lot of acronyms for things that are available. There are a lot of clinics and systems in which people are getting, as many people are getting turned away as are seeking help. We need to change all of that. So that's a little bit of a diatribe on that. But treatment works. The medicine buprenorphine, the medicine methadone, the medicine Vivitrol, all of those work. Buprenorphine is an agonist, so it helps the opioid receptors and is also a shield. It will block heroin, fentanyl, other drugs. Methadone is an agonist. These are excellent medications studied over many years with literally 50% or more overdose reversal rates, meaning people who are on these medications have a 50% less chance of dying from overdose. I don't know if there's any other medication out there that works that well. Wow. So that's really important for us to be able to move on fast.
Dr. Stern, thank you.
Thank you, Anjali. And I just want to point out that buprenorphine is an incredibly safe medication. It is almost impossible to overdose on buprenorphine unless you're completely opioid naive. So again, really important to keep it away from children and make sure if you're in treatment that nobody, that no children have access to it. People need to have safes for their medications, or if they're using, to try and do it safely. But buprenorphine itself is so safe to give, and there's just been, even within the medical community, a lot of fear about it, and the barriers that were put up in order for physicians and providers to be able to prescribe it were so high that a lot of them were turned off and were afraid. But really, it saves lives, and the risk with that is so low. So I just want to put out as well to the medical community, most providers need to understand this medication, it's safe, and it works.
All right, thank you.
Can I respond?
Yes.
One other part of your question was about how long should treatment be, right? And I think that's a question that a lot of people struggle with. We talked earlier about addiction as a chronic illness, and I think it's really important to continue to think of it that way. Right? When I have an infection and I get some antibiotics, the antibiotics cure the infection, and I'm good. I don't have an infection anymore. It's not a chronic illness. But like diabetes, like blood pressure, addictions are chronic illnesses. So really, we need to always be, I think, vigilant about it, no matter how well we're doing. The way that but the idea of like, well, so do I need to be on a treatment forever? I think that's really overwhelming to people when they're approaching treatment. So what I say to people is I say, how about we think about this for about a year? Let's try this for a year. A year is like long enough to change who you're hanging out with and learn how to cope with life's difficulties a little bit differently. And then let's revisit the topic, right? I'm not saying it's cured after a year. Usually a year comes by or comes around and we have the conversation and it goes like, there's no way I'm getting off this treatment. My family trusts me again and like I'm doing really well and my health is good. And it's because of this treatment. Long-term use of these medicines that we keep mentioning, methadone, buprenorphine or Suboxone, naltrexone, there are no real long-term problems for our health. They don't hurt our body or anything like that. They are safe to be on long-term. So I think the other thing that can kind of be confusing if we're somebody who loves somebody in treatment is, hey, you've been going to this clinic now for a year, 2 years, and you've been doing really well. Like, why don't you just stop? Like, you're done. And I think that message can come from a place of love, but it might not be the best thing for that person. It might be that you're encouraging them to get out of the treatment that is helping them do so well. And so just something to think about. Again, encouraging people to do something for their recovery long term.
Yes, go ahead.
If I can, sorry.
Oh, we'll take this question first. Go ahead.
Sure. I would just add, I think while all of this medication-assisted treatment is really, really critical, and we are strong supporters on the county side of all medication-assisted treatment resources, I think when we think about treatment, it has to be more than that, right? I think that there is a treatment mentality that's very, in some populations, very medication-centric, and that's even just on the physical health side, right? But just like needing a blood pressure medication to control your blood pressure, you also have to think about diet and exercise and lifestyle changes. So when we think about treatment in this conversation, we have to think about it in so many other ways, right? It's counseling. I think Dr. Duhigg mentioned, the ability to just engage in healthy social settings, right? At our program, we participate in healthy parks and recreation, right, for healthy recreational activities, right? That's not something you traditionally think of as treatment, but teaching folks how to play basketball when they're bored, right? Or to engage with the right population. Those things are really, really important. And I'd be remiss if I didn't get on my cultural sensitivity soapbox as well, because I think treatment is also important. We must always think about people's generational and cultural trauma that brings them to that space, and how do we include culturally sensitive practices in that treatment as well. Is it important for me to meet with my curandera every once in a while? I think so, right? Is it important for me to participate in sweat lodges to help with my detox and help with my treatment? Is it important for me to get acupuncture and acu-detox, right? There's so many other avenues that really are important in that wraparound treatment that do nothing more but expand the reach that medication-assisted treatment provides. And so as the non-MD at this table, I just had to get on that soapbox and just recognize how important all those other aspects are of treatment. And above and beyond just the individual, it's working with the families, right? I cannot be successful unless my support system is also successful and their trauma is also addressed in that conversation.
And earlier, Snehal, you're jumping in. It's a great point, Margarita, right? We were talking about like prevention and talking to kids. And I think a big part of that is also strengthening those connections, right? Like there is actually data like that where they've looked at, for example, indigenous children. And if you strengthen their connection to culture, to grandparents, to language, that serves as a prevention against substance use, right? And I also think about it, for example, with my kid, like when he hangs out with his grandparents or learns his traditions, like that's good for his development. That gives him resilience that protects him. So I totally appreciate your point, and I agree with it, right? We want to treat the whole person, and we want to individualize it, right? That one thing, like, may work for one person, but it may be totally against the other person's wishes or belief system, so we don't want to standardize it. And at the same time, if there are any, like, prescribers out there, right, in the audience, one thing I really want to emphasize is that, yeah, we want to add all of these things in, But we can't do any of it unless the person engages in treatment, unless the person stays in treatment. And what's the surefire way to get someone with opioid use disorder who's using fentanyl, for example, into treatment and get them to stay in treatment? Get them started on the medication, right? There is new data showing that as soon after you start someone on buprenorphine, the risk of dying from an overdose drops dramatically. So don't say that you have to see a therapist 6 times or go to 10 groups before you meet with a prescriber. If they have an opioid use disorder, get them on a medicine, get them started, start saving their lives, and then understand them, engage with them, understand them, and start adding in all these magical things.
I would like to,
oh, go ahead.
I'm sorry.
No, you're fine.
You know, we're talking about treatment, and I would feel totally bad if we didn't say some of the barriers to accessing treatment. And some of those barriers are stigma. We have come a long way as a state in addressing stigma and educating folks on listening with compassion and learning how drug dependency works and listening with non-judgment. But we have a long way to go. We have a long way to go. There are still folks that aren't accessing treatment because stigma still exists. It's real. And we need to do our part to link individuals so they can become ready to seek that change in their own lives and they can feel empowered to do so because they don't feel judged.
We touched on prevention, and with that comes education a little bit. Let's dive into that a little more deeply. How do you think it's best to approach the education angle of just preventing this from the start, right? Age to start, age appropriate, the kind of talks everyone should be having at the youngest age, and then on through, of course, middle school and high school. Dr. Taneja, do you want to speak to that first? Or anyone who'd like to speak to that?
I can speak to that
Okay.
a little bit. You know, and to kind of add on to some of the treatment discussion too, you know, we treat young people, so adolescents, ages 14 to 21, and you know, the access to treatment is just abysmal for that age group. It's almost non-existent. And so we work really hard, you know, with the providers that do exist in the community, but just to try and get our clients access to treatment, because it's very difficult, because nobody wants to deal with, you know, the attitude of teenagers, because it is really difficult to deal with that age group. But as you know, as far as just prevention, we do a lot of work with APS. We do a lot of work with the schools. I myself, as a mom, my son passed away of a heroin overdose when he was 18. So I know now the signs that I should have seen and the warning signs that I should have seen back then. I didn't know what those were then. And so, you know, one of the biggest things for us is really talking to parents and talking to teachers and schools and just trying to get the word out on what you can keep an eye out for, because, you know, catching somebody before they start using fentanyl, you know, catching somebody maybe with a mental health issue or behavioral health issue that they need medication for that's prescribed by a doctor is huge, because if you wait too long, they're going to find that medication on the street that's going to make them feel better, and unfortunately that medication is probably what's going to end up killing them. So I think, you know, prevention is key, and I can't emphasize that enough. You know, talk to your loved one, talk to your children, talk to your nieces, your nephews, your brothers, your sisters, whoever it is. Just keep, you know, really pay attention to those cues. And like was said earlier, you know, if the behaviors start to change, if there's something in your gut just telling you that something's just not right, pay attention to that, because it's almost 100% spot on usually.
I'd like to also add about the education component that the Albuquerque Public School Crossroads counselors do. We work with many of our community partners that are here today. October is Red Ribbon Month, which is a national event, and we have the DEA coming into many of our high schools and putting on different programs. We work very hard to bring in all sorts of different educational programming. The biggest part of our job as APS Crossroads counselors is education and prevention. So we go into the classrooms and do specific evidence-based curriculum based on the age group, but we also do assemblies, we bring in community speakers, we have resource fairs, we do evening events with our parents and our communities. So we're always looking to find different ways to address substance use and substance use concerns with our adolescents and teens.
And what do you think is missing, though? Perhaps at the elementary level? I know I have a daughter that just finished elementary school, and it was a wonderful school, but never was it mentioned that there would be any type of assembly or talk, like all the we talked about the drug use at home. You know, kids would have things on the playground, and I'd explain the gummy bear situation, right? We were doing stories like that on the news about elementary school kids going to the hospital because of the gummy bears and, you know, them containing marijuana and such. But do you think this should start earlier than middle school, high school? Is there a plan to start doing that more?
Yes, definitely. I mean, we think that early education is key. And having those talks early on and continuing that conversation is important. Age-appropriate education is important. Many of our families worry that if they bring up that conversation with their child, that it might make them interested or seek behaviors to use drugs. And we dispel that myth. That's not true. That's reducing, we want to reduce the stigma around substance use. So talking early, talking regular to our students is important. Each elementary school has a school counselor. Middle schools all have counselors as well. And then, of course, in high school, we have the Crossroads counselors that do work with our elementary schools, but our primary focus is our high school first, middle school second, and then trickling down into elementary school.
Okay, thank you. Yes.
To just add a little bit to that, because I think it's a good question, right? And I think, honestly, we've been working ever since the days of DARE to try to figure out what is the school-based intervention, right? So for anybody who doesn't know, DARE didn't work. And we really haven't cracked the code on that. And so while I think it is important to have these conversations at the school, actually, if we look at the research that's been done, I think that points to how important the conversation at home is, and that it's actually maybe a little bit more important than leaving this up to the schools. Like, I was really surprised to learn that in surveys, teenagers say that they put more importance on their parents' views of drug use than they do their peers. I don't think they'd admit that if they were just asked. But in a survey, they feel safe enough to say that. So I think it is important for us to talk to our kids. And I think the way that we talk to them about it is super important, right? So essentially what this research showed is that when parents gave messages like, in our family we don't use, right? Or even if I've been in recovery, like, we're going forward, like, we're not using, right? Or we don't think that this is kind of what we do. The kids really internalize that message. I think when we talk to kids about, man, I used to get so high, and like I've learned from, don't do like I did, that generally doesn't work, right? Because don't do like I do. No teenager kind of takes that as good guidance. So I think it's important that we give the message. This is not what we do. This is, our family is like, we'll learn how to cope through other methods. The other thing is, and again, it comes from research, and this is a little bit of harm reduction, is, you know, we can acknowledge that as humans across the globe experiment with intoxicants. We can't find a community that doesn't. So how do we talk to our kids about that? It might sound funny at first, but really the guidance right now is, what we should say to our kids is, if you're going to experiment, right? If. We're not telling them go experiment. If you're going to experiment, wait till you're 19. And 19 sounds like, well, where does that number come from? It's totally based on statistics. If we start to use intoxicants before 19, we're much more likely to develop an addiction or a substance use disorder as an adult, compared to if we start to experiment after 19. Now, it's not like, you know, hell, as long as I'm 19 or over, I'm never going to get an addiction. It's still a risk, but statistically, way less likely. So, you know, again, and I think we can give both of those messages. In our family, we don't use drugs, or we don't get high, or, you know, even if we did before, we're not doing that going forward. And if you decide to experiment, wait till you're 19. That's kind of the good evidence based approach to reducing harms.
And just to add to that too, I think a lot of parents don't initiate that conversation with their youth because they don't know the subject matter. So really empowering you guys as parents to educate yourself on emerging drug trends. You guys are doing an amazing job already being here today and learning about fentanyl, learning about naloxone and different things. And that is so vital to having those conversations. Sometimes we don't, as parents, have those conversations because we're afraid of the questions that might come after, right? We don't know how to address it. And it's not even so much to tell them don't do it, but give them that this is because this is the why, right? Because lots of youth don't want to hear, just don't do it, don't do it. They're curious, well, why not? Tell me. And again, if you don't know the subject matter, you're not going to feel comfortable talking to your youth. And there are so many resources out there on the internet that you could just Google. I say ask or Google anything, right? So ask Google on emerging drug trends in youth, how to have conversations. There's one Talk They Listen website that gives you some amazing resources and tools to equip you, to empower you to have those conversations with your youth.
Yeah, great advice there. Thank you. This next topic it's complex. So how do we address the intersection of the fentanyl use with our criminal justice system? Cory, Lee, can we start with you?
Sure. I think first we have to address the criminal justice system. I heard earlier on one of the panels, the question as to why more people aren't signing up for specialty courts. Well, I think there are a lot of providers in this room who can say that navigating court systems is very difficult. And if you're navigating that, you're probably also navigating all of the requirements, right? So if you're going to a counselor, that counselor then wants you to do something else. If you're going to a methadone clinic, they want you to go to counseling. So if I am going to sign up for a program that's going to basically make it virtually impossible for me to exceed, why am I going to sign up for that program? I'm not, right? Also, it's education, not education for, it's education for the public, but it's also education for judges and prosecutors and public defenders. And not education through a licensed social worker. I mean, that's great. I love clinicians, you're amazing. But there should always be a peer support worker in the room providing that training, right? A peer support worker should always be at the table, no matter what is happening. When we are talking substance use, there needs to be a peer support worker there. Yeah. So, you know, we talk about the criminal justice system and the intersection of fentanyl and substance use. Well, when it comes down to it, it's how is the criminal justice system responding to substance use across the board? And I think most of us can say we might have concerns that the response is not as trauma responsive as it could be.
Thank you. You know, we talked about the stigma associated with all of this, and we hear it and we see it every day, right? What about the social impact for the families using fentanyl and what that does to the family structure, their kids perhaps, who are a part of this activity daily and seeing things they shouldn't be seeing? Steve Decker, can you speak about that?
Sure. So Heading Home currently operates the largest family shelter in the Albuquerque area. And of those families, all but a handful have been directly affected by fentanyl. And the reason that they have found themselves homeless and in the family shelter is because of fentanyl use. Over and over, literally almost every day, we have staff who are reporting that they had to use Narcan on the site for a parent. We have heartbreaking stories of mothers who were found by their children dead in the bathroom because they were using and they were trying to hide their use from their child. Mm-hmm. The impact on families in fentanyl is far more than just the families that end up homeless, of course. The reality is, when we talk about there's not enough foster families in the state of New Mexico, when we talk about there's not enough law enforcement in the state of New Mexico, when we start talking about the lack of healthcare providers in New Mexico, we can look over and over again that what's happening is because the family systems are breaking down and those connections are being destroyed, that's what snowballs into all these other effects. The reality is, if we had a real solution to fentanyl, my family shelter would be empty, but it's not.
Oh. Thank you. Gilbert Ramirez, what about your department? How are you seeking out those who need the help, and what are you doing for them?
Thank you. So I've been a long-standing practitioner in the community as a clinician and primarily working with adolescents and their families. understanding the challenges that come with young people and or our communities seeking or looking to folks for support, you have to understand the window of opportunity sometimes can be really tight. And that one time that the kid's just talking about something they're doing, if you don't pay attention and or listen to that, it could close, right? And you have to take them serious. And I'm a parent of 2 children, and I know they ramble on and on and on, and it takes a lot of intentional focus for me to hear everything that comes out of their mouth. But they do want to talk to you. And engaging them and being able to break down those barriers for them to access that is huge. When we talk about the impacts, the social impacts on a family, you know, one of the quotes that I've always used with my young people in talking to them is that if you don't do the work to heal from the injury that hurt you, you're going to bleed on the people who didn't cut you. And I think you have to understand that statement, because families have to take on the impact of the individual who they care for who is battling this addiction. And they're bleeding on you, even though we didn't cut them. And those impacts are huge, right? We have the issue of the fact that emotionally, you're going to feel a range of emotions of anger, maybe being upset, worried, fearful that your loved one is going to die and not show up. There's financial impact in the family, right? If you were a breadwinner in the home, maybe your focus of your finances now to supply the substance you need to survive and stay well every day. You have relationship issues at home where now maybe the relationship with your partner and or your children is now fractured because there's instability in the house. You now have folks who no longer want to associate with you and are being isolated, right? So the social impacts on a family is huge. And that's where, you know, we as city government entities, providers, others who are doing this work, I mean, I keep hearing peer, and it's so important to understand that one of the biggest psychological motivating factors for someone to change their behavior is the fact that there's someone involved in them who, 1, they trust, and 2, they can rely on. Now, whether that is a family member, a blood tie, a counselor at a school, or just someone who cares about you, it is so important, and that's why peers are so effective. They come from the life, they've experienced that, and they can walk you through it because they understand it, right? And if you haven't, then you can't walk that path with them. And that's the hardest thing around making sure we wrap ourselves around these families when you talk about the social impacts of fentanyl and or any substance on our community, is that how do we address those issues, right? You can also understand that if you're a parent using, you're afraid that, you know, the state will come in and take your children, so you're going to hide that. Right? You're going to teach your children to hide that and not mention that. It's what you do to kind of keep your unit whole. Of course, as a family, as a department here, we want to increase access to services and treatment and also understand where the gaps in those treatment availability is. If you don't have insurance, right, treatment is one piece, and it can take a long time. But if you're having to make a decision between putting a tank of gas in your car or some food on the table and or a $35 copay 2 to 3 times a week because you have to show up for treatment, you're making a decision to not go to treatment, right? We saw this during the pandemic. Families didn't access services. And ultimately at the base, understanding that there's a level and root of, I mean, fentanyl is a pain medicine, right? It's to address pain. Now, whether that pain is physical and or psychological or emotional, it's real. And when you start talking with young people who are maybe having issues of anxiety or depression, that's a huge piece. When we talked about what should we do at the schools, also understand that if your kid had an injury, a sports-related injury or otherwise, happened to go to a doctor, happened to get a prescription, you should be having that same conversation. You know, we might think, not my kid, right? This doesn't discriminate. As we saw with the statistics, from accidental overdoses of children under the age of 1 all the way through, doesn't matter race, gender, community, socioeconomic status. It's available. Now going back to what we have to do, because typically as city government entities supporting those services, it's what's visible. And what's visible, sadly, are a population of folks who are the most vulnerable. Those who are unhoused, those who are on the streets. But please, by no means, don't think that those issues don't exist in people who have the fortunate privilege to have a home or an apartment or actually hold a job. It's across the board. But what we see is the community in front of us, and that's why it's so prevalent in front of our face. Now, we do have to commit to changing that. We do have to commit to filling some of those gaps in services. If you can't afford the co-pays, we want to provide the treatment without the copay. right? If the courts are working on programs but don't have treatment providers, we partner with them to make sure they know about our programs, who we're funding, and they can make those referrals. We're working with the county to fill some of the gaps in the other areas, and we can't do this alone, right? It does require all of us. So, I mean, back to the original question. We have programs. We need to do more to educate folks on how to access them. We have to continue to prioritize where we put the money to be able to make sure we bolster whatever is missing so that folks can have access to it, because that treatment does take a long time. You're literally trying to have someone develop new coping strategies to deal with something that they have learned another way to deal with. And that's painful, it's hard, and sometimes you got to do it alone because you've pretty much alienated your support network because they don't know how to support you. And that is where the challenge is. I'm a social worker, I've got skills, I can navigate systems. Now, let's add a language issue. Let's add a learning disability issue. Let's add another medical issue, or any of those things, add another complex layer to the strategy on how you're going to get that help. Our job is to figure out how do we get it out, how do we let you know it's there, how do we make sure we have the partners at the table, and then how do we fund those services that are kind of missing to make sure they're available as soon as possible for folks, because again, when I started talking, the window can be very small, and a person might be contemplating that change right in that moment, and then it may shift and say, nope, no longer. You got to jump on that and make sure those connections are made immediately.
Thank you. And some of those coping strategies, Margarita, let's talk about the behavioral health department. What are you finding, state, city, you know, our state is so huge, but at the city level, the county level, and the state level, how far is the reach, and any new innovative efforts being made on how to reach people to help them with these coping strategies that were mentioned?
So there's a lot of work to be done, right, at all levels, from the federal level all the way down to the local level. And we are more fortunate here in Bernalillo County in the city of Albuquerque than the rest of the state really is, right, because we have some resources available where in rural New Mexico there is little to none. And so again, we're fortunate here, and we're fortunate with the support of the County Commission for the passing of the behavioral health tax to dedicate funding to services. We're fortunate to receive funding from the state through liquor excise tax to provide some resources, right? I think, again, we are grateful for that, but there's still so much work to do. We have been able to expand the services at the CARE campus to have a peer living room. I echo what Cory and others have said about the value of a peer. It's immeasurable, right? The value of a peer who has walked the walk and talked the talk. I can have a conversation with someone all day long and say the exact same thing and have no impact. And a peer can have a conversation for 5 minutes and hit it. And again, I think it's really, really important to recognize that. Now, nationwide, and even at a higher level in New Mexico, we have a provider shortage at every single level of that continuum. We are short on counselors, we're short on clinicians, we're short on every single prescribing providers. Even I'm short on substance abuse techs, right? All the way across the board, we are short on providers. And so we need to do a better job with what we have to get folks into that services, into that treatment, and really leverage our peers. Right? Our clients who are the success stories, who go into recovery and are doing an amazing job, we need to support them in becoming peers, right? We can't just say, oh, we're going to hire whatever peers show up our door. No, we need to encourage our clients and help them, pay for the certification for them, get them into those classes, get them into their hours that they need to get that certification. We need to do everything we can to support that. So I think really above and beyond, you know, what do we need to do? And that's not just build more programs. We need to build the workforce, right? We need to build that workforce because we can build programs all day. And if we have open beds because we have nobody to staff the beds to get people into, we're in no better place than we were before, other than we spent money on a new building. Right? So I think we need to really work collectively. Poor Gilbert and I talk more than I think I talk to my husband because the city and the county work very closely to do this work, shoulder to shoulder. And I think we're grateful for the state leadership that is also in line with us. We're right as we speak. We're on a meeting this morning about collaboration with the state to do better on this work. And so I think, again, really leveraging federal resources, state resources, build the workforce, and get out into the community to make sure that folks are not waiting 2 weeks to do a Suboxone intake, right? making sure that folks can get into a Suboxone intake tomorrow or today, right? We were, just before we started, we had that conversation about ASAP being able to do that, and I think that that's phenomenal, because to Gilbert's point, when that window is open, we need to take that opportunity and not say, hey, come back 3 days later and then let's talk about it, right? Much less 120 days later, right? So we really need to do a better job of making that accessibility front and center, and in order to do that, we need to build the workforce. So if anybody here is a provider or a peer or a tech who needs a job, I have a job for you. I'm just going to put that plug out there. But again, it's just really important for us to do all that we can to wrap around folks in every setting.
You know, so often we hear about Albuquerque, the greater Albuquerque area, having the drug problem, the fentanyl issues, you know, the larger cities, and then also having the resources, right? They'll hear about help, and even on the news, we'll talk about where to get the help in Santa Fe, Albuquerque, et cetera. What about rural New Mexico? You know, so often those areas are forgotten, right? And they need a lot of help too. Are you seeing a rise in fentanyl use in these rural communities, and what can they do, or what kind of stories can we do for folks watching from these rural areas? They just don't have a lot of access to care, and if they want access, they might have to drive 3+ hours to get it to a larger city. So what, anyone want to take that question? What's the answer for that, or what's your advice to them? In our, yeah.
I was at a panel a couple of weeks ago, and a man said, you know, there's so many people coming to Albuquerque. Can we figure out why they're coming and not do that? And it stopped me for a second. And I realized what he was saying is, I flipped the narrative. The narrative is there's not enough resources in small towns. Mm-hmm. And if we're going to do something, Albuquerque has lots of resources, and yet it doesn't have enough. But what we really also need is to address the lack of resources in small towns, whether it's affordable housing or whether it's MAT services. And I know that there's a conversation happening around that, but we need more conversation.
Do you think there's a particular group, you know, I know you touched on the homeless earlier, susceptible to fentanyl use, but as we also know, we can see this in any type of family, regardless of socioeconomic status. But is there a particular group in general, or even at the high school level, you know, maybe certain kids who are being bullied, or is there any particular group that you feel might be at higher risk that's not so obvious? Yeah, Dr. Stern.
No. I think the risk is everywhere and can happen to anyone. Mm-hmm. And I think it's really important that people understand that as well, that you know, we have this illusion it's going to happen to somebody else and not be in their family.
Okay, thank you. Steve Decker.
So I respectfully disagree a little bit. I think that what we see time and time again is that the people most likely to fall into the trap of addiction are the ones who have been isolated, whether because of a disability, a mental illness, physically isolated because they are in rural areas where they don't have access to services, or isolated because they are bullied. I think it's been said many a time that the opposite of addiction is connection, and that's what we see in the people who succeed and who beat it. When they talk about the peer workers, that's the impact. The populations that are most at risk across the board are people who are isolated. Why do we see such a rampant use in the population that are experiencing homelessness? It's because they are very isolated. Why do we see such a ramp up in the rural areas? It's because they are disconnected. And over we see that. I have employees whose children were isolated due to mental illness. It's the isolation that creates that biggest risk factor. And anyone can feel isolated, but isolation, I think, is a direct impact towards the addiction.
With family and community services, Gilbert, what are you seeing? Are you seeing a particular group?
Yeah, you know, I think it's important to remember that there are inequities in some of the systems that we've created, right? And when you have inequities in systems and access to care, you're going to have populations who are more vulnerable for risk. Mm-hmm. So let's just be real clear. You know, those things do affect you, and it also affects your ability to be successful in treatment. I may not have the same family structure and or financial resources that other families have to be able to be successful. We also know, at least in the world that I worked with adolescents, we've got to ship our kids out of state sometimes for detox. How does treating an individual by separating them from their family units and or community really support that when they return, right? It's a practice we've had because we don't have the resources for some folks, especially if you're taking advantage of like public services, right? So I do think that our goal, our mission has always been to really make sure that we are investing our funding into filling some of those gaps across that continuum to make sure people have access and that it's equitably accessible to all folks, not just certain populations, right? And we need to do better about educating our community on what's available, making sure that they know that they can access those services. And so we see it across the board in family community, everything from community centers and early childhood development programs all the way on up to some funding and support for area on aging and senior affairs, right? We cover that spectrum. And we know that at every one of those touch points, we have an opportunity to educate, provide information on access to resources, help families do that, but sometimes the work does get siloed, right? That happens innately in all pieces, and so we've got to make sure we're all communicating, all sharing that information, and then hearing what the community is saying as far as needed services, right? Which leads to like one of the collaboratives that we're doing, bringing a medical sobering center to the community. We can do better. You know we need that service. It's been identified, and we're going to partner to make that become a realization. We have no youth detox in the city that's a public service. We are working to reestablish that, right? These are missing services that we need to bring. And yeah, of course, we talked earlier about resources, and maybe it isn't or just about, but we know there's some gaps in them that we could do better. And we're still trying to rebuild this system of care. I start talking at a system level. Parity in health and behavioral health needs to happen. You know, statewide, we need to make sure that we ensure and provide the adequate coverage. If you're bleeding out and your arm is hanging out a bone, you're going to get surgery and have the appropriate treatment to care for that. Yet, if you're dealing with substance use or addiction, the treatment's different. Your path has to be prioritized in another way. You know, and we've long heard sometimes you can get that quicker through the prison system than you can through our community system. That should not be our narrative. Our narrative should be that we have just as good quality access and services in our community, and you don't have to travel through that system. And that's why not criminalizing this topic, these folks who need this help is so, so important. There has to be other avenues.
All right, thank you. In the school setting, Jessica.
What we do know in the schools is that all of our schools are affected by substance use. So we know that many of our adolescents are using for, no matter where they are within the city, our adolescents are struggling. So as we've heard here, many of our adolescents are struggling with anxiety, depression, trauma, stress. So substance use is in all of our schools. It's not just in one area. And that is one reason why we have crossword counselors at all 13 high schools.
All right, thank you. We're going to wrap up with a final question. If someone you know, a loved one, is struggling with addiction, with fentanyl use or drugs of any kind, what advice would you have for them? Jennifer Burke, as a mom, what advice would you have?
Well, I think, and I get asked this question a lot, and I personally dealt with it myself in my own situation, but, you know, I think part of it is what we've talked about today, is just having that conversation with your loved one. I know as a parent, you're scared you're going to say the wrong thing, you don't know what to say. A lot of us have never been there ourselves, or if you have been there, you know, you're afraid you're going to say the wrong thing and maybe possibly encourage use. Like Dr. Duhigg was saying, it's like, well, you know, I used or I didn't use, but, you know, you don't want to say the wrong thing, and then your kids suddenly think it's okay. And so I think from my perspective, it's important to have those conversations, and it's important to just tell the truth. Just say, look, I've never been where you're at right now. I've never had these same struggles, and I don't know what it's like, but I want to learn, and I want to help you however I can. So, you know, opening up that conversation just as simply as saying, like, help me understand, like, what can I do for you? Because I'm not really sure what that looks like. And then not judging them. I mean, they're putting a lot of shame and blame and judging on themselves as it is. And you don't want to add to that, because they're already carrying this huge weighted blanket, and you don't want to keep adding to that. So showing support for them, setting boundaries is really important. Setting boundaries for yourself and your household and your family, but set boundaries that you're going to stick to. Don't say you're going to do something and then don't do it. That's the worst thing you can do. If you're going to say, I'm going to take your cell phone away if this happens, then you better take their cell phone away when that happens. Mm-hmm. And don't set something that you're not going to follow through on, because you're just going to create more of an issue. But having those open conversations and just, you know, educating yourself. I mean, you know, like we talked about earlier, earlier, like there's, you know, the internet has a ton of resources, there's a ton of information out there. Talk to you know, trusted people that you know in the community, and just find out for yourself what's going on out there, because, you know, it's a different world right now. It's a different world than when my son was using. I mean, my son passed away in 2011, and since then, the drug world has changed tremendously, and the access to drugs has changed tremendously. And so even myself, I have to constantly keep researching and learning new things so that I can at least try and stay one step ahead of it. But having the conversation and just being honest with them, I think, is the best way to try and help your loved one. And then there's a ton of treatment out there. Treatment does work. We've talked about this. Treatment works. There's a lot of treatment options. There's medically assisted treatment, like we talked about. There's intensive outpatient treatment. There's 12-step. There's a lot of treatment available, and sometimes it takes a little of everything. So sometimes you may have to just, you know, try all different types of treatment, and then you're gonna, you know, your loved one's gonna pull from that what they need, and, you know, we call it a toolbox, and then you bring all the tools in your toolbox, and whenever you need that tool, you pull it out and you use it. But those are critical things. And the other thing I would recommend is just self-care for family members and parents. Make sure you're taking care of yourself. Make sure you're seeking counseling yourself. This is a family disease. Make sure that, you know, you're going to Nar-Anon meetings or Al-Anon meetings. There's several meetings throughout Albuquerque for parents that are struggling with a loved one who's addicted. So reach out to those groups, take care of yourself, because you can't take care of somebody else if you're falling apart yourself.
You know, for people who literally want an instruction manual, there actually is one. I don't mean this to be like a commercial plug or anything, but there's an amazing book out there, and it's called Get Your Loved One Sober, Alternatives to Pleading, Nagging, and Threatening, which don't work, right? But this book is amazing. It just happens to be written by two people from a place called the University of New Mexico.
That's right.
It's used all over the world. It's in many languages. It's really approachable. It's all based on science. It's not just somebody's ideas. And it's literally an instruction manual to, you know, how to set boundaries but still be loving, right? How to talk to people who are living with a substance use disorder, what things to respond to and how, and what things to not respond to, because that usually just leads to fights. So anybody who's looking for an instruction manual, that's the best one I've found.
All right, some great advice.
I totally second that. Dan, actually, you took that out of my mouth, those words. I totally agree. And neither of us got any royalties from the book sales or anything, but it's been a good resource for a lot of my patients and community members, so I also highly recommend it.
Lastly, what would you say, though, about people who you want to give the advice, but your advice or your intervention is met with nothing but denial? I mean, that's so hard for so many families.
It's very hard, but
Yeah.
I think, again, just trying to encourage them and give them some positive feedback. You know, just say, thank you so much. I'm really proud of you for sitting here with me today. I'm proud of you because you spent one day sober. I mean, they've got so much shame, and all around them they've had so much negativity. So, you know, when I'm working with people and they come back the next day and I said, I'm really proud of you, you came back the next day. And they're like, oh, thank you, nobody said anything nice to me. So, you know, that's part of the kind of coming to them with love, is as hard as it's been for you, just to find something positive to share lets them know that you care in that way.
I think that's really important. And one other thing I want to add is we use, at Serenity Mesa, we use a program called Nurtured Heart, and it's exactly that. It's focusing on the things that they're doing well in that moment. And as a parent, I wish I would have had Nurtured Heart training when my son was struggling with his addiction, because I was so much waiting for that other shoe to drop. I was waiting for something to go wrong, and that's all I focused on, because I was so caught up and I was so wrapped up in his addiction. And I wish, you know, that I would have seen the good things that he was doing and focused on those good things, because in that moment, that's what they need to hear is, you know, oh, you came home on time tonight. Thank you for coming home on time, instead of just focusing on all the times that they came home late. So I think that's a great piece of advice.
How about a round of applause for our panelists? Oh, go ahead.
I'm sorry, is offering them not only help but hope. change is possible and change is absolutely worth it, as is evident with all the peer support workers out there doing an amazing job. I'm extremely proud of you.
Yes.
Great, thank you so much. I do want to ask a question, though, and you kind of touched on this, and I mean, don't get me wrong, I was a doting parent, loved my girls to death. They would probably tell you I smothered them. You pay the bill on this for your child. Do you have the right to take it and look at who they're texting? Question. If you're a parent, do you look at your child's phone? Is that cool or is that not cool?
I would say yes, and you also have to set that expectation with the child. So, I mean, you have to say, okay, I'm willing to pay for your phone, however, these are the rules, these are the limits. And you set what you're comfortable with, whether it's checking their phone at random or whether it's checking it if you have suspicions or just having the passcode to it. I think you have to set those expectations up front so that you both understand what that agreement looks like.
And is it a help? Is this helping them?
I think it can be. I think it matters how you approach it, right?
Right.
I mean, best case scenario, you look at their phone with them,
Okay.
right? And you can talk about what you see.
I like that. All right. Great panel. Wouldn't you agree? Thank you very much. Thank you so much, Shelly Ribando, for doing this. This is a great thing. And we hope you're learning a lot out of all of this.